friend of mine has two young kids, and they have a nanny, and she's great. She actually feels like a surrogate grandmother in the house, and she is a grandmother herself. She has cancer. It's a cancer that is going to kill her, but it has treatment, but it isn't 100% successful, this treatment. And what she's decided to do is to not have the treatment, because she's decided for the last few months and hopefully years of her life, she wants to be present and lucid for her grandchildren. She knows that if she takes the treatment, she's going to be back and forth to the hospital, and she's going to be under the fog of some pretty tough drugs. And she doesn't want that. She wants to be there for her grandchildren, and she wants her grandchildren to remember her as a present, lucid, and fun grandmother. Now, as a human being, her oncologist understands that. He gets that she's making a choice. But it's difficult for the healthcare system to understand that, because in black and white, she looks like a patient who's amenable to treatment. It's not an insurance issue. She has the right insurance. The deductibles are affordable. It's just simply a choice about what she wants from her life. And the healthcare system is really struggling with that. We'll go back to the grandmother. I have another friend who's a soccer player, and he's a really keen soccer player. He's played at a very good level most of his life. And about 4 years ago, he ended up having pretty severe back issues. And it turned out that he'd herniated a disc, and that actually was in huge amounts of pain. He waited a while, and then eventually realized that he needed to have surgery, and he had the surgery, and the next day, the neurosurgeon told him that actually his back was more of a mess than he initially thought. And his advice was, as part of your rehabilitation, don't think about going back to the level of soccer that you were used to. Go back to a notch below. And my friend looked at him and thought, I don't even know what that means. I can't perform lower than I used to perform. His entire life was based on playing soccer and the community that he'd created around playing soccer, where his friends were. The idea of either swapping in a new sport or playing below his natural level just made no sense at all. And so he ignored the neurosurgeon, and he went back to playing the level that he used to play. Now, the neurosurgeon is a human being. He gets that. He gets that soccer's what matters to him. But the healthcare system struggles with that, because ultimately what it's saying is you're going to make yourself ill again. We can't support that. Now, what the grandmother and the soccer player are illustrating is that they have a broader definition of health than the healthcare system does. The healthcare system thinks about health on the basis of disease. Pathos is the Greek for disease, to create genesis, pathogenesis. Healthcare is designed around pathogenesis, either the creation of disease or the potential of disease. And so on that basis, the decision by the grandmother to stay unwell, or the decision by the soccer player to perhaps become unwell again, makes no sense at all. And the healthcare system jars with that. But the grandmother and the soccer player have a broader definition of health. And interestingly, both of them are trying to do the same thing. The grandmother is looking for a deeper connection with her grandchildren before she dies. And the soccer player doesn't want to lose his connection with his old teammates. What they're prioritizing are their interpersonal connections, because that's what makes them feel good, makes them feel healthy. Now, that's not anything that their healthcare system can help them with, but that really matters to them. So the healthcare system's lens of pathogenesis makes no sense. So what's the lens that they're using? Well, they're thinking about health. They're thinking about creating something positive. The Latin for health is salus. To create health is salutagenesis. And so the lens of the grandmother and the soccer player is one of salutagenesis. It's a completely different lens to pathogenesis. Now, healthcare actually understands salutagenesis. There was a beautiful paper by J. Michael McGinnis, now of the Institute of Medicine, in 2002. And he looked at premature mortality. Why do people die younger than we think they will? And one of the first things he realized was that in terms of avoiding premature mortality, healthcare could help somewhere between 10 to 15% of the time. That's it. It occurs to me rather immediately that a healthcare system designed around pathogenesis isn't particularly effective in reducing premature mortality. He goes on to describe that actually it's our social factors and our environment that actually matter most. And within that was the idea of interpersonal relationships. They actually together, the social and environmental factors, came to over 60%. So actually, the choice that the grandmother and the soccer player were making by prioritizing their interpersonal relationships was probably smarter than any choice the healthcare system could give them, because they were playing in the 60%, not in the 15%. Now that paper goes on to describe that actually social isolation increases your chance of premature mortality somewhere between 2 to 5 times. Forget the 5, 2. You have double the chance of dying early if you're socially isolated. That sounds a pretty incredible stat just there. What else did that paper show? Well, actually, let's stay with social isolation, because there's also been a recent paper that illustrated that lonely people, we can see neurochemical changes in the brain in people who are lonely. And what was quite interesting when that paper came out is it led to a small flurry of news suggesting that loneliness had finally become a drug target. You could take a pill to reverse the neurochemical changes and you'd no longer be lonely. That is a pathogenesis model of how to think about loneliness. That is how a healthcare system designed around pathogenesis thinks about loneliness, because it sees the biochemical changes and wants to make a change. That's what healthcare does. The solutagenesis model goes around to that person's house, knocks on the door and says, "Would you like a cup of tea?" And you can sit down, you can have a conversation. What else did that paper, the McGuinness paper from 2002, show us? Actually, it showed us something that I feel like I have learned when I was at med school, which was over 20 years ago, which is that the one thing most correlated with better health outcomes is education. And we're not talking about teaching people about hypertension and how to deal with myocardial infarcts or first-line therapy and COPD. We're just talking about the basics, giving people the literacy and numeracy skills to help them to handle the trials and tribulations of modern life. Next in line was having a regular income. There's nothing like having some kind of financial security in your life to help you make better decisions. Couple that with having a half-decent education, and people would make very clear salutagenic decisions. They will make decisions that help them create health before they need the system designed around pathogenesis. The third example I'll give from that paper is my favorite, but for all the wrong reasons. Income inequality. For every 1% increase in income inequality, the mortality rate, the premature mortality rate increases 4% in the lower income. Now, I'm from the UK, here in the US, I think we're all seeing income inequality growing. And it's important that we all, if we are going to realize that the rich are getting richer, we have to ask ourselves to finish off that saying. The rich are getting richer, and the poor are dying sooner. Because that's the reality of that situation. What is salutagenesis? Sort of sounds like a fancy word, but we know what we can understand a system around pathogenesis because we're all used to it. It's called the healthcare system. There's a problem in someone's biology, we go in and do something about it. It's a very immediate and clear system. So what's salutagenesis? Well, it seems kind of simple that actually the grandmother was looking for a connection, was looking to deepen her connection with her grandchildren. And the soccer player didn't want to lose and wanted to grow his connection with his teammates. So they're actually trying to do the same thing. But the services that may help them both could look significantly different. So that makes it difficult, because what we've got used to when we think about health are big systems that do the same thing for everyone. Treat hypertension in the same way. First-line therapy is always the same, etc., etc. But that isn't what a salutagenic model is going to be about. It's going to be about being more local, being more niche. So how are we going to know if it works? Actually, that's the simplest part. Because people will tell you it works. If the grandmother got time to spend with her grandchildren, she'll tell you. If the soccer player got to play at the level that he wanted, he'll tell you. So actually, it'll be very easy to understand value. And if we can understand value, we can potentially transact it. And if we can transact it, we can create sustainable business models. Now, I'm not here in the US to tell you to spend more money on health. $2.7 trillion, 18% of GDP, somewhere around the 30th best outcomes depending on how you measure it. It's pretty bad, guys. You've got a lot of work to do. But one of the reasons why you have that problem is because you only pay for a system based on pathogenesis. Instead of spending all 2.7 trillion on a system based on pathogenesis, why not spend some of that on creating a new system based on salutagenesis? And what's quite amazing is the system that you have on pathogenesis is well known for operating at something like 20 to 30% waste. So $2.7 trillion, 20 to 30% waste is about $800 billion. That, to me, feels like pretty good seed capital to try to work out what that new system looks like. I've been lucky to be joined by 21 other people trying to understand what health beyond the lens of healthcare looks like. What does an industry based on salutagenesis look like? And the 22 of us have formed together a kind of informal band, and we're called the Creating Health Collaborative. And we're trying to work this out. What would an intervention look like? How would you value it? How would you know it worked? Because that's what needs to happen. If we're going to stem the growth of healthcare, it's going to be about finding something else. But what I like about it most is that the healthcare system as we all have it today is based on what doctors tell us we should have. In healthcare, a product is a diagnosis. The moment you can label someone, you can start billing against it. Who gets to create the diagnoses? The doctors. So actually, healthcare has become a supply-based industry, a beautifully primed industry that will only grow because the people who control it continue to create diagnoses. That will never, ever stop. That is a brilliant economic model for making more and more money. That will not stop. So you have to create the alternative. And that's why I actually think this alternative is very, very simple. Because the people who get to say what it is are the people who want it. The people in the communities. The grandmother and the soccer player. Which is why I always say that the future of health is about giving people and communities a true voice. Thank you.